patients present to Camberwell Sports and Spinal Medicine with a headache, and this type of headache that we can commonly treat is called a cervicogenic headache. So put simply, this means that the headache itself is originating from particular structures within the neck and the upper back. Some of the symptoms that people might be presenting with will actually mimic the symptoms of a migraine or another type of headache.
Does this reproduce a particular type of headache for you in here?
Generally, a patient will present with a gradual progression of a dull ache which is located towards the base of the skull, sometimes over the forehead, around the ears or around the jawline. They also may be presenting with a poor concentration, maybe some blurred vision. Sometimes we find that patients are presenting with headaches that are worse in the morning, and they may be blaming their pillow. If the pillow is influencing it, that is something that we will address as well, but it can be after a particular aggravating activity the day before that the next morning that's when you're waking up stiff through the neck, and therefore the pain is referring up to the head.
And do you feel a stretch there through the top of your shoulder?
Treatment will involve a thorough history to begin with, and then moving on to an assessment involving the neck, the upper back and sometimes the upper limb as well. What we will then do is decide which treatment approach will best suit you. If you're coming in quite an acute phase, we'll try and just settle down the symptoms. This might include some gentle soft tissue, some joint mobilisation and sometimes some joint manipulation. In other times we might utilise some dry needling or some postural taping, which will help offload some of the structures that might be affected. The pain that you might be feeling may come on in an acute onset, in which case it can be quite sharp after a heavy lifting incident or even a minor car accident. Otherwise it can be more gradually building up, which is more so seen in our desk workers who are sustaining a particular type of posture for a long period of time and the muscles fatigue. The reason why you're feeling pain in your head and the source of it may be coming from your neck is because the structures within your neck, such as your muscles, your ligaments and your joints, are supplied by the top three upper cervical nerves. We know that the area of skin over your head, in terms of the base of your skull, over your forehead, behind your ears and along your jawline, is supplied by this same nerve. So the pain that you're experiencing is actually referred pain from a structure that is actually further away from the site that you're experiencing it.
Just let me know if you experience any pain at all.
As osteopaths, we're here to try and find the cause of your pain. So not only are we trying to find some symptomatic relief for you in the short term, we want to make sure that we can hopefully provide you with long-term relief, and also encourage you to have a treatment plan or a management plan that you can look into ways that you can prevent further episodes from occurring.